Time now for Morning Rounds. Joining us are CBS News Chief Medical Correspondent Dr. John LaPook and CBS News contributor Dr. Holly Phillips. First up this week, college athletes and head injuries. The NCAA settled a $70 million class action lawsuit. The money will pay for neurological testing, but not for treatment. There will also be a new policy for returning injured players to the game. As Mark Strassman reports, the settlement could cover a staggering number of people.
Lawyer Steve Berman represents injured former players who sued the NCAA.
Players are being returned to the game too early because of bad concussion management. And if you go to the game too early, you are at risk for a serious long-term brain injury. And that's what we're trying to prevent in this settlement.
The NCAA has agreed to pay for any college athlete from the last 50 years to get neurological testing. Every current college athlete will get a preseason neurological test to help diagnose any concussion later on. They'll also be protected by a uniform policy about when they can play again after a head injury. No athlete with a diagnosed concussion could rejoin the same practice or game in football, basketball, soccer, ice hockey, wrestling, field hockey, and lacrosse. At Kennesaw State University in Georgia, women's lacrosse is one of 18 NCAA sports.
You certainly don't want to return someone from a head injury before they're ready, and sometimes that decision-making is difficult.
Mike Young is the school's director of sports medicine.
Hopefully this will help sports medicine staffs across the country get what they need to properly take care of the student athletes.
Because the more everybody's on board, the easier your job gets about taking a kid who is at risk because he's just been hurt, getting him out of the game and getting him help.
Right.
The NCAA admitted no wrongdoing in the settlement. It said in a statement, "We have been and will continue to be committed to student-athlete safety."
John, the money in this lawsuit goes to testing and diagnosis. But what about prevention and treatment?
Well, it does not go to prevention and treatment. And specifically in terms of prevention, the helmets that are out there, there's no evidence that they prevent concussion. So this, of course, is something that's a big question that's open.
In studying this, though, in this case in particular, doctors must have learned a lot about concussions, though.
Yeah, I think what we realize now is that, especially in the developing brain, the younger you are, the worse it is. And the worst thing that can happen is for you to get a concussion and then go right back and play. And of course, the culture is to fake it, to pretend that you didn't get the concussion, to minimize your symptoms because I got to be out there for the team. And that's one of the big issues.
Also this week, there is a new warning about common drugs that may be sitting in your medicine cabinet. Every day, 46 people die from legal pain pills. Consumer Reports just published an investigation into both prescription and over-the-counter painkillers. So, Holly, what about the people who think they're using the drugs as they're intended to be?
Right. Well, Vanita, it's not only the people who get the drugs illicitly who run into problems. A lot of us have that perception. But thousands and thousands of prescriptions for these drugs are given out each year. In fact, the number of prescriptions has gone up 300% in the last decade. And so even if you take them as they're directed and they're given to you by your doctor for pain, you can run into problems, particularly if you mix them with other drugs that you might not even think would cause a problem, if you get behind the wheel of a car. And there's always, even in low doses, there's always the potential for addiction and then subsequent abuse.
Holly, the study found that even over-the-counter pain relievers carry risks. So when should you take something over-the-counter and when should you take something stronger?
Sure. Anthony, really the rule is whatever you take the smallest dose you can and for the shortest amount of time. More than 80,000 people go to the hospital, to the ER for complications from acetaminophen, which is the medicine found in Tylenol. We take it all the time. It's over the counter and we think of it as not harmful, but actually it can be mixed with other drugs and really cause problems. So no drug is completely safe, and try and use as little as we can.
Tan skin is damaged skin and could cost you your life. That's the message in a new report from the U.S. Surgeon General. For the first time, he's calling skin cancer a major public health problem. Deadly skin cancer cases have jumped 200% since the 1970s. The Surgeon General blames both indoor and outdoor tanning. The advice: check your skin for new moles and use at least 1 ounce of sunscreen every 2 hours. Doctors remind you to protect your kids because childhood sunburns can increase their cancer risk as they grow up.
Researchers have found that running for even just 5 minutes a day can lower a person's risk of dying from cardiovascular disease. The study looked at 55,000 adults over a 15-year period and found those who run consistently lowered their risk the most. But people who ran less than an hour and people who ran fewer miles at a slower pace still had a 45% lower risk of death from heart disease or stroke compared to non-runners. So what can we learn from this, John?
Well, this is a fun result, right? Because even doing 5 or 10 minutes of running, jogging, or 15 minutes of a brisk walk can really make a difference. And I know when I tell my patients, I want you to do 20 to 30 minutes, 4 or 5 times a week, and they saw their eyes glaze over. So this is even a little bit.
Thanks, Doc. So, Holly, are there other exercises that achieve the same result?
Yeah, you know what? I think it has just to do with doing a small amount of really intense exercise that the researchers found made the difference here. And, John, you're absolutely right. The biggest hurdle, I think, for all of us in exercising is time. I think about my own day. I'm like, where am I going to find time? But if you think you only need a few minutes and anything that you do will make a difference, then I think it's easier to get out there and go. Whether it's power walking or cycling or roller skating, whatever it is, just a few minutes will make us less sedentary and, in theory, we'll live longer.
And the fact is, if you go out for just 5 minutes, you're likely probably to do more than that.
It's true.